I'm Rex Rogosh, and let's queer up trans rights. 25 arrested as activist protests proposed federal limits on gender-affirming care for trans youth. More than 50 activists gathered Tuesday in Washington, D.C., protesting proposed federal rules that would restrict access to gender-affirming care for transgender minors. The demonstration was organized by the Gender Liberation Movement, with participation from ACT UP New York and ACT UP Pittsburgh. Protesters assembled outside the Hubert H. Humphrey Building, headquarters of the U.S. Department of Health and Human Services. Activists blocked the building's entrance, held signs reading, quote, "Hands off our moans," end quote, and chanted in support of trans youth. Authorities say 25 people were arrested for blocking access to the building. Those individuals are now in the custody of D.C.'s Metropolitan Police Department. The protest coincided with the final day for public comment on the proposed rules. On the same day, 106 members of Congress sent a letter opposing the measures. The rules proposed in December 2025 by HHS Secretary Robert F. Kennedy Jr. would bar hospitals providing gender-affirming care to minors from participating in Medicare and Medicaid. They would also prohibit federal Medicaid and children's health insurance programs funds for covering such care and exclude gender dysmorphia from protections under Section 504 of the Rehabilitation Act. I mean, look, protesting is not illegal. Let them do it. Granted, there are rules, so they got arrested. But, again, we keep looking at, all of these rules and regulations and laws and committee members saying, you shouldn't do this. And now you're, again, if you're a hospital or a doctor giving affirming care, then the way this is reading, the hospital can't be in Medicare or Medicaid, which means you're not just punishing the 1%, you're now punishing an entire community in an area. So you're not doing harm to just one person. Now you're harming the full community. And I think other people need to start realizing that, I think a lot of people sit and go, oh, well, I don't know somebody who's trans, which they probably do, or that doesn't affect me. Well, but it does, because these rules open up floodgates, or they're written in such a vague way that it does affect you if they want it to.
Also, if they, besides the fact that this is horrendous and directly harming people, if they can decide one group of people can't get access to healthcare, what's to make them decide that they don't want to give healthcare to the Irish or to people in just the state of Connecticut? It gets down a very random, weirdo, wacko place, which is exactly what you would expect a guy like Robert Kennedy Jr. to do, because he's been running HHS like a crazy house. It's absolutely been insane to watch what's been going on at HHS lately. Like, the first Trump term was very scary. They were trying to make it so that a doctor could deny your care, not just based on their religion, but their personal morality. I'm like, well, what the heck did that mean? What if my morality means I just don't like girls with like a certain hairstyle or something?
Right.
But this is a whole other level. Now, on the arrest, for my work, I do workers' rights advocacy. We do protests. People get arrested at protests all the time. Exactly. That's a normal part. Unfortunately, but it's a good protest is bothering the people in power. Like, if you just go say, we disagree with you, they don't care. If you make it harder to get in and out of their building, you ruin their day. That is that helps to annoy them. And unfortunately, that's what you have to do with this administration, is annoy them, make their day hard, and really gunk up the work sort of.
It'll be interesting too. You talked about broader language, and you look at other groups who rely on hormone replacement, and they're not trans, but males, females, intersex individuals at different levels of care. How hypocritical is it to provide them with it's really gender affirming care? I saw something online briefly before coming in, and they were talking about Musk, and of course he paid for it out of his own pocket, but he had his jawline refined. He took more testosterone to achieve a look that he didn't have. Mm-hmm. He took minoxidil, for his hairline. And, where does it...
But don't just think about just hormone, but if they can do this on one type of treatment without going through proper, we're used to think the FDA having this crazy thing called licensed medical professionals make these calls. If they can just arbitrarily make this call, what's to stop Robert Kennedy Jr. from starting to question the validity of chemotherapy for cancer patients? They literally went back and forth with a Moderna flu vaccine in the last couple of weeks because he just personally doesn't like it. This is America's healthcare system is in huge danger right now with this. Like, yeah, I don't mean to sound hysterical, but there's no other way to talk about healthcare in America
No.
right now.
It's a mess. It really
No, I mean, you're quite right. And, Larry, you think about when any woman who has hit menopause is on hormone therapy or should be on hormone therapy. So that is gender affirming care, because if your hormones are out of whack, it could cause, problems. Same with older gentlemen. When their testosterone levels start to diminish, they get put on testosterone. That is gender affirming care, so that your estrogen, and you go on estrogen blockers. There's so many medical reasons for gender affirming care. It's not just for transitioning.
No, I mean, could you imagine if those types of care were not available to individuals? Our first lady, some of those folks, and they would be walking around with beards and mustaches, all kinds of things going on.
Well, and I don't want to picture Madam Trump with a beard. That's horrific, Larry.
With her little Hamburglar hat.
The sad thing is we've talked about that before, and we've talked about what happens if they do something and then all of a sudden their care, and we've reported on that, and there was a woman sitting on a bed, and she had to have some form of abortion, and she was like, call the governor, and they were like, nope, we can't do that.
Well, the criminalization of women's health care has been even worse. Like, women who have had miscarriages are being potentially prosecuted for murder. Doctors don't want to treat women because of it, which I get very upset with the doctors about. I'm like, no, you still do your duty to save a person's life, but like, this is where this is all going with this particular Health and Human Services, and also like for trans people, like the idea of trying to force someone to stop taking hormones, that's also just horrific to do to a person.
Exactly.
Like, how would you such a jarring change to your life? Like, if I take a mental health medication that was ripped away from me, that would be really awful.
And it can have huge ramifications on your physical body in general. So you're putting somebody's life at risk, not only mentally but physically as well. So yeah, I mean, there's a lot of ramifications.
The only other thing I'll say is I'm just glad to see Erin Reed doing more reporting on this. She's a great reporter, and I'm glad that we cover more of her stories.
Absolutely. Well, there is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.